Your eyes play an integral role in determining your first impression. So when you have dark circles around them, they can make you look tired and unhappy.
I feel like dark circles come from fatigue and a lack of sleep. When I get them, they make me look really tired and swamped with work.
I think some people naturally have them like I do, and you also get them if you're tired. It makes you look pretty sick and tired.
There are many reasons why people get dark circles. Being exposed to ultraviolet rays, rubbing your eyes constantly, and losing fat under the eyes can all lead to the dark under-eye rings. Dark circles accompanied by a stuffy or runny nose may stem from allergic rhinitis. Not only that, those with stress or fatigue that burdens the liver and kidneys, or people who have suffered from atopic dermatitis for prolonged periods can also get dark circles from a lack of nutrition and discoloration in the skin. Treatment options for the dark rings differ depending on the cause. Kim Sang-hoon is experiencing trouble from his dark rings that have become more severe due to his irregular lifestyle. But he says the dark patches have been around since he was young and that they won't easily go away.
My dark circles have gotten worse these days, and a lot of people have been telling me that I look really tired. It started stressing me out a lot, so I came to receive treatment.
Over half the people who seek medical help for dark circles have discoloration problems. In this case, they need to receive laser treatment to remove the melanin pigment and burn off noticeable blood vessels. Also, by receiving skin whitening treatment with vitamins, it can create a much brighter tone around the eyes. If the dark rings are caused from a lack of fat underneath the eyes, dermal fillers can be used to add fat. A hyaluronic acid filler combined with hemocyte extracted from your own blood requires only a short period of time for the procedure, and it lasts for roughly 20 to 24 months, making it a popular option. You can see how the procedure can help people regain a brighter image compared to before.
Dark circles cannot completely be treated, and maintenance afterwards is very important. The condition is created not only by one problem. They're related to blood circulation, pigmentation, and fat tissue. So getting a lot of sleep regularly or using facial masks to keep your skin healthy will help relieve some of the symptoms.
When the dark circles are caused by a weakness in the liver or kidneys, Korean medicine can be used for treatment.
People who naturally have weaker livers or kidneys get tired more easily, and their water metabolism is low, so they have a greater tendency of getting dark circles.
In order to strengthen the function of the liver and kidneys, a herbal medicinal infusion is provided according to the body conditions of each individual. In the case of severe wrinkles around the eyes, meseonchim acupuncture is used to relieve the symptoms, and results begin to show after roughly 2 weeks of treatment. Patients with allergic rhinitis often have dark circles. When blood circulation within the nasal cavity is poor, a pigment called hemosiderin within the blood causes pigmentation, leading to the dark rings.
One of the most common causes of dark circles is allergic rhinitis. In order to see whether you have it, you need to receive an allergy test or blood test to find out what the antigen is. Once you've confirmed the cause, you can avoid it, treat the condition to boost immunity against it, or receive surgery.
When the problems stem from the nasal cavity, the priority is to treat the infection in the nasal area to recover the function of the mucous membrane. This will allow for good circulation around the nose and under the eyes, in effect, removing the dark circles. Steam inhalation is an effective method in providing moisture in the nasal cavity to reduce the symptoms of allergic rhinitis. A healthy lifestyle and treatment fit for your body can help get rid of dark circles to give you a boost in confidence and help you make a better first impression.
So there's a multitude of reasons that you can actually get dark circles under the eyes, everything from fatigue to kidney problems or rhinitis. We looked at that. Or you might just be born with it, for that matter. So we'll get a look at some of the answers behind this and also the treatment options that are out there with Dr. Hong Young-ho joining us from G Clinic Aesthetic Medicine. Good morning.
Good morning. Welcome to our show.
Morning.
So as we saw in the report, there are various factors that can cause the dark rings under your eyes, but many people say that that you get them when you are tired. So does this have anything to do with the amount of sleep you get?
Studies have shown that poor sleep leads to poor skin condition. There's something called the autonomic nervous system in our body, and it controls the blood and body fluid circulation. And if you don't get good sleep and good rest, it can interfere with the system, which leads to swollen or discoloration or sunken look under the eyes. The skin around the eyes is actually very thin compared to other parts of the body, so it's more vulnerable to the outside environment, such as dry weather or cold weather. And of course, the internal conditions such as fatigue, stress, and lack of sleep.
That explains a lot. These dark rings under my eyes.
Use the eye cream.
And we looked at some of the non-surgical methods, including the fillers and also the laser treatments. Can you see some improvements after just one procedure? And what are some of the things that you need to keep in mind after getting the treatment?
If the dark circles are a result of decreased fat tissue around the eye area, we can reinforce it with injectable dermal fillers, which is actually a very simple procedure, and it only takes about 10 to 15 minutes. Okay, and it takes about a few days for the little swelling to go away.
So you don't have to really worry about it causing you to stay home from work or anything like that for long periods of time. But there are laser treatments and also the fillers that we were talking about that you can actually see results after just one application or one treatment, right? But what if you have a severe case? I mean, how do you know if you actually need to get invasive surgery for this instead of just regular fillers?
Those who need somewhat more invasive surgical procedures are those patients whose dark circles are due to bulging of the fat pad under the eyes due to fat accumulation and loss of skin tension. This is more common in middle-aged women and middle-aged men, and the surgical fat removal or surgical rearrangement of the fat under the eyes is necessary for those.
Okay. Well, what about home remedies? We've seen or we've heard of people saying that putting salmon around your eyes. I don't know. I've heard this from someone, really. But anyhow, home remedies like that. Salmon, for example, does it really work or have any effect at all?
Patching your eye under the eye skin with raw salmon, I'm not too sure about that. There's a metabolite called astaxanthin, which is found in lobsters and shrimps, and indeed in salmon. And it has some good effects in our body to fight fatigue and relieve pain, and it's also good for skin protection. I think the idea came from there.
Okay.
But you would have to ingest it rather than putting it onto your face.
Okay, so don't put it on your face, eat the salmon, right? Okay, that makes sense. I think it's more useful that way.
Right. And apart from the foods that you recommended or you talked about, what are some of the other tips that we can use at home? Perhaps a massage or like a cooling thing?
Yeah, we can always make use of warm towels and your fingers just to simply dab the skin around your eyes to promote better blood circulation.
Can you maybe show us some of the key points?
Just simply dabbing.
Just around the eye
Not too
area.
much rubbing it.
Okay.
Okay. And it promotes better blood circulation. And we could make use of some of the products such as facial masks or eye masks to give moisture to the skin.
Okay, so moisturize, massage, and heat up a little bit and take care of your eyes. Get plenty of rest, and if you have rhinitis, get that treated too. Salmon, eat the salmon.
Eat the salmon. Don't apply the salmon onto your skin.
Dr. Hong, thank you so much for joining us on this.
Thank you.